introduce our keynote speaker, Stephen Nowotniak. This keynote will illuminate the inner landscape of bipolar disorder and challenge you to consider how purpose can emerge from pain, how identity can evolve through adversity, and how lived experience can be a source of strength, both personal and clinical.
Good morning, Minnesota. How are you doing this morning? I just want to take a minute and ask you all to acknowledge Michelle and the team that put this conference together. It is I just want to throw out there, take a look at your cell phones, make sure that they're on silent, that way nobody ever gets that awkward ding, 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 ding in the middle of a session. So just go ahead and take a look and make sure it's on silent. I want to begin by sharing with you all a time that I felt completely trapped and overwhelmed and had no idea what to do. In May of 2000, I set off on an 8-month non-motorized trekker service from Buffalo, New York, down to Key West, Florida. Went 2,000 miles and part of a multidisciplinary master's degree at Buffalo State University. On this trek, I canoed across New York State on the Erie Canal, sailed the Hudson River down to New York City, backpacked the Appalachian Trail to Roanoke, Virginia, and then biked to Key West, Florida. I gave presentations to over 1,000 youth on the values of volunteerism and education, did over 230 hours of community service, and studied the geology along the way as part of a multidisciplinary master's degree at Buffalo State University. It was an epic adventure, and one that I will never forget. This tale that I'm about to share takes place in Pennsylvania, which was 2 months into the trek and 2 weeks down the Appalachian Trail. It was a gorgeous day. Warm sun, blue sky, cool breeze caressing my skin. It was most excellent. I rounded the bend and came across a cliff with a gorgeous view of the valley below. So I decided I would take a break. Took off my pack, sat down, and just marveled in the moment. A little while later, it was time to move on. So I stood up, threw my pack on my back, turned around and going. A rattlesnake had snuck up behind me. Startled, I took a couple steps back until I remembered I'm on a cliff. I looked behind me. My heel was just at the edge of the cliff. I shifted my weight, knocked off a pebble, and just watched it fall. Took a step to get off the cliff. The rattlesnake had moved. Have you ever heard the phrase stuck between a rock and a hard place? Well, here I was trapped between a rattlesnake and a ravine. My body froze. My mind fogged out. I lost all sense of time. I'll never forget the first thought that popped into my head when I could start thinking. And it was, God, it's tough to do stuff for you if I'm dead. Interesting where your mind can go. Anyway, after a little while, I just got this warm feeling, and this phrase came to me. And the phrase was, I can handle this. Now, I don't know if I believed it when I was staring down that rattlesnake, but I kept saying it over and over again in my head. I can handle this. I can handle this. I can handle this. So I started to look around from that perspective, and I tried to figure out what I could do. And I saw this flat rock off to the side. So I summoned my strength, took a giant leap of faith, jumped to the rock, although I was a lot more in shape and a lot more graceful. But anyway, I listened for the snake. Nothing. Took a small step off the rock. Still silence. Took one more step just to make sure it was safe. Silence. Oh my gosh, I let out the exhale of my life. Worked my way back to the trail, continued on my way, and continued on down towards the Key West North. Feeling trapped and overwhelmed when facing a challenge is something that we can all experience in our journey of life. And the perspective that we take when facing that challenge matters. Take, for example, the phrase, I can handle this. I can just as easily been staring there, I can handle this, I can handle this. Both start with lots of reasons and justifications for them, and they both start with a leap of faith. But what happens when I can handle this just isn't enough? What happens when that venomous bite of life gets you? What happens if you end up taking that great fall? That happened to me in August of 2002 when I was hospitalized for severe depression and diagnosed with bipolar disorder. When that happened, I felt hopeless, I felt broken, and I was ashamed. I felt hopeless because nothing I did could pull me out of that state of despair that led me to the hospital. I felt broken because here I was, 27 years old with a master's degree, and yet I had no idea how to live. And I was ashamed because now all that stigma of mental illness came crashing down upon me. This was my lowest point. And again, one that I will never forget. Once again, I was trapped and overwhelmed with no idea what to do. And once again, it was the power perspective that started to make a difference. My journey living with bipolar has been a journey of 4 perspectives. The first perspective, when I was first diagnosed, about coping with symptoms of an illness. So it was pretty rough, and the feelings were pretty dark, and I didn't know how to deal with them. And so my therapy at that time had to do with medication and talk therapy. And it was about how do I feel better. So medication was helpful because it helped soften the intensity of the symptoms. But an antipsychotic is very different than an antibiotic. Like an antibiotic makes all the yucky stuff go away, then you go back to the way you were. But an antipsychotic, there's a few layers to that onion. First off, the stigma. Antipsychotic. That's a heavy one to take. Second of all, they don't make all the magic, all the yucky stuff go away. So what you're doing is you're balancing this whole thing about softening the intensity of the symptoms so like you experience life a little differently. And then you're taking this balance between benefits and side effects. And that is its own journey. The second thing that I was working on was talk therapy. And with talk therapy, it was really about how do you process some of these experiences and emotions that you're doing. And once again, the focus was how do I feel better. One of the biggest things that stood out to me with dealing with talk therapy was how to deal with negative self-talk. Because negative self-talk can scream pretty loud when you're in the darkness of depression or anxiety. And one of the things that stood out the most to me was just the attitude that when that voice is going on, that dialogue is going on, to associate it with as an opinion rather than fact. I got out and I would spend a few years trying to figure out how to live, getting the medication set, trying to track what my mood symptoms were like and the cycles and all that kind of stuff. And after a few years and a few job attempts later, I ended up joining a program called VESID. And VESID stands for Vocational and Educational Support for Individuals with Disabilities. It's Access VR now. And when I joined that program, they were able to, my counselor, when we were talking, was able to connect that what I love doing is helping people do what's important to them. It just so happens that large groups of third people and all day was a bit much for me. And they introduced me to a certain kind of profession, which happens to be OT. You can give applause for OT. I went back to school for my occupational therapy assistant degree. Where are all the OTAs in the room? Raise your hand. Bravo! Bravo! And I'll never forget, when I was sitting in the classroom learning about energy conservation, working with people with COPD. And we started to talk about how to pace, not push. And we started to talk about maybe setting things up the night before so it's easier in the morning. It started to click. Wait a minute. This can help me. Because when I'm dealing with the depressive episodes, I'm in this mental fog and lack of energy, I can get out of bed easier doing it this way. And then other things started to click. Like sensory integration, when I'm dealing with that internal chaos, being able to be mindful and purposeful of what I'm doing, what I'm seeing, smelling, tasting, hearing, all that kind of stuff, and how that can help me soothe the internal chaos that I'm dealing with when I'm having those experiences. And it shifted. It shifted to my second perspective. And that's managing the needs of a condition. It stepped beyond coping with symptoms and trying to figure out how to feel better. And it started to get into what was I doing so that I could have the quality of life that I wanted to do. And as I was addressing it, there were needs that had to be addressed. And as I addressed those, I could continue on and do those things that bring meaning and value to my life beyond just staying out of the hospital. Managing the needs of the condition and focusing on what I was doing. I got my occupational therapy assistant degree, really fell in love with the process, so I was working as an occupational therapy assistant and went to Utica University. Anybody from Utica here? Shout out to Utica, I'm honored. I did the weekend hybrid program while I was working. And got my degree. And then I started working in a supported nursing facility. And after about a year or so, I found myself curious about the profession and all the different populations that our profession works with. And I didn't want to spend my life working with one population simply because that was the first job that I got out of college. So I did travel therapy. And as a travel therapist, I kept one job so it didn't look like I was job jumping. But I had a chance to explore, working at a hospital setting, working with early intervention, working with students, working with home health, working with rehab, just exploring the profession. And as I was doing that, I started to feel this tug. And this tug had to do with mental health. Because here I am, an occupational therapist, a licensed healthcare provider, and I'm living with bipolar. So I just felt this responsibility to try to help improve our understanding and treatment of it. And when I started getting involved with mental health, I came across a group of people called the peers. And the mental health peer movement was a group of people with diagnoses themselves, lived experiences themselves, helping to do two things. Number one, advocate for better treatment. It was part of the civil rights movement in the 70s. Nothing about us without us, and voice and choice in treatment were two really big rally cries in the movement. But it was more than just a civil rights movement. It was a beacon of hope. Because again, here were people that were doing more than staying out of the hospital. They were having the courage to disclose that, yes, I have a mental health condition myself, and I'm here to support you. And as I was doing that, I'll never forget, there was a program called RAP, Wellness Recovery Action Plan. And when I was doing that, the diagnosis wasn't even considered. It was all about getting to know what are those things that you can do to be well, stay well, be connected with yourself, and be connected with others. It was about getting to know what is it like for a good day, and how do you know you have a good day. And then what external triggers can happen that can set you off and send you down a different direction. And then what can you do about them in a healthy way when they show up? Or even early warning signs. What does it feel like inside of you when you're having that challenge? How do you know you're going through a challenging time? What does that feel like, and what do you do about it? And as I was doing it, the diagnosis was set down. And it wasn't about the condition. It was just about Steve, getting to know Steve. What are my strengths? What are my challenges? How do I use my strengths to overcome my challenges so I can be my best self? It wasn't a journey of an illness. It was a journey of personal growth and development. And what I realized was that there are skills and tools good for everybody. But the need for certain skills and tools becomes more evident given the situation you're in. Take diet and exercise, for example. Diet and exercise is good for everybody. But if you're an athlete, the need to watch your diet and exercise is more evident. Does that make sense? Same thing with negative self-talk. I started to realize negative self-talk is a pretty human thing, not just a pathological thing. Like when I went to propose to my wife, I was nervous. I was worried if she would say yes. I am grateful she said yes. My wife's in the back recording. How about this? Has anybody graduated with your degree and went to go with your first group of people and wonder, do I know what to do? Can anybody relate to that imposter syndrome? Negative self-talk. Or how about this? You just become a supervisor, and now you're working with people and staff that you have to work with and support and manage. Anybody have a little self-doubt on that? Negative self-talk. Now here's the interesting thing. The cause of that negative self-talk is different. The intensity of that negative self-talk is different. But if you look at it from a strictly functional point of view, it's the same. And the skills that help address that is the same. It's an opinion. It's not fact. And what happens is when we look at personal and professional growth and development, it's not about fixing something that's wrong, it's about improving ourselves so that we can be our best self. It's a slightly different approach than you're sick. And what do we need to do to fix you? One sends you on a journey that there's something wrong with you, especially if it's chronic and going to be your entire life. That means always something's wrong with you and you're broken. And that seeps into confidence and identity. The other, here's just where you're at. And how we help you take your life to the next level and be your best self. Approach can be very similar. No, techniques and skills can be very similar. The approach is very different and sends you in two different directions. I started to feel this encouragement and this desire to help people who are going through the struggle. And that brought me to a realization that sometimes the struggle doesn't always have to be an obstacle. A challenge, yes, but it can also be an opportunity. How can I turn value out of my journey? How can I find purpose from my pain? My purpose has to do with helping to demystify and destigmatize mental illness so that I can help improve our understanding and treatment of it, to make it help it be a little less scary and a little less foreign and help with our approach. So what I'd like to do, if it's okay, is share with you a little bit about what those symptoms associated with bipolar feel like. Because here's what happens. You're seeing that people are doing behavior that doesn't always fit with the situation that's going on. And so then it can be odd, and it can not make sense, and it can be difficult to understand. That's because the behaviors and actions are being done based on what's going on within and addressing an internal experience. So let me ask you this. Who here, show of hands, has ever been really sick and had the flu? Raise your hand. All right, good. I mean, not good that you're right. Thank you for raising your hand and not leaving me with crickets. Anyway, so when you're feeling really sick and having the flu, are you energetic? No. Feeling really sluggish, right? I've done this with a lot of classes and I've asked people, and while yes, there's a couple times when people will say what stood out was coughing or sore throat or some of those kinds of things, pretty universally, it's not that stands out the most. It's the exhaustion. It's the body ache. It's the head fog. It's the difficulty thinking through things. When you're sick and have the flu, do you want to get showered and dressed and get ready, or do you want to stay in bed in your pajamas? In bed in your pajamas, right? You tend to withdraw. Can anybody relate to this? Oh, wait. I'm not saying it's the same thing, but why someone can go to when they're having suicidal ideation is that the experience is uncomfortable and it's not stopping. I just want that experience to end. I once saw this really cool cartoon. And it had two people, and one person was saying to the other, "You got so much going for you, why are you depressed?" And the person said to the other, "Well, there's so much oxygen in the air, why can't you breathe if you have asthma?" So it's not the stuff. And so when you're sick and have the flu, you want someone saying, "Come on, you got so much going for you." I'll take that as a no. No, you want someone sitting there, "Hey, I know you're feeling crappy, but just say, just like wash your face and try to feel a little better." It's the approach. Does this help? Thumb up, thumb side, thumbs down with depression and how it's not just a sadness thing? And again, when I share these things, I can't say this is exactly the same for every single person, but what I want to try to do is help you an anchor point. So that way there could be maybe something to connect with or relate to help understand the approach that we do when we work with people. Okay. Who here has ever been over-caffeinated? You know, the restless energy, that jitteriness, the heart, and then you try to do something and it doesn't really dissipate the energy, and you can jump from one thing to another. Yeah, put that on the shelf. All right, who here knows of somebody that has ever had a couple alcoholic beverages and gotten pleasantly buzzed? Knows of a person. Is familiar with this individual. All right, so this person that you know, when they're feeling buzzed, are they quiet or are they maybe a little more outgoing? A little more outgoing. Things feel good. And they feel like they're all gonna work out. And there can be a little more charisma, there can be a little more outgoingness, there can be decreased inhibitions, right? So take overly caffeinated and pleasantly buzzed. Put those two together, and that's parallel to hypomania. So you're feeling like things are gonna work out, you have this energy, you have this creativity, everything makes sense, but you lose objectivity. Going along with this analogy, has this person that you've known ever had a couple more drinks and gone from pleasantly buzzed to being drunk? There could be increased behaviors with that, right? Has anybody ever met the drunk philosopher? The one who has all the answers to life's problems? Do they want to tell you that, or do they want to keep that to themselves? Right? I had this epiphany, this is great. And by the way, is that a short conversation or a long drawn out conversation? Hyperverbalism. Because there can be a lot of stuff going on that you're just trying to share and you're just putting it out there and going and going and going and going. And things make sense in that moment, in that feeling. That when you're sober, it no longer makes sense. So just like with hypomania, mania, when you're having those experiences, things make sense in that moment, that then when you're not, don't make sense anymore. Okay. Following that drunk experience, this person that you know, what tends to happen the next day? The hangover, right? And as bad or as intense as the drunk experience is, that's how intense the hangover can be, right? So following a manic moment, there could be the post-manic depressive episode crash. And what happens is, as I found, learning to live with bipolar has been much like learning how to drink responsibly, more so than just coping or fixing an illness. Because the alcohol is always going to affect you, right? It doesn't stop affecting you. But what you learn how to do is drink more responsibly. You learn how to pace. You learn how to drink water. You learn to eat. You learn to turn over your car keys, right? You start to learn how to work with it as opposed to fight it. And so that's been my experience. Thumb up, thumb side, thumbs down. Did this help explain and demystify a little bit about what some of those experiences are like? Excellent. Now, I shared a little bit about my story with challenges. But let me ask you, have you ever faced a challenge? And when you're facing a challenge, have you ever found yourself in the beginning focusing on how you're feeling and doing things to feel better when you're having the struggle of the challenge? And then after a little while, do you find yourself doing things about it? Not just how you're feeling, but realizing this is something that I have to do, something I have to deal with, something I have to work towards, and address it. And then as you're working on that challenge and doing things to address it, have you ever found yourself learning something, either from it or learning something to address it? And finally, have you ever found yourself in the struggle finding some sort of meaning or purpose that you never would have had without the journey? This was my journey of how to live with bipolar. But learning to live with bipolar is very different than learning to accept it as something that I have to live with my entire life. Have you ever noticed that when you're accepting things you like, it's easy? But if you have something you don't like and have to accept it, that's far more difficult. And it's never one and done. You may find, okay, I've gotten through it, I've gotten to a point where I'm accepting it now, and then tomorrow you're angry at me. So it comes and goes, it ebbs and flows. It's not like I've made progress and fallen back. It's just, this is where I am today and how can I move forward? So what I've done is I've created a tool that I've used for myself, and I've shared it with some people, and some people I've found helpful to help deal with accepting something that I don't like and don't want. And the bottom rung is curse, and there's 5 levels, and it goes to gift. Now, I'm not saying the thing is a gift. Like, I'm not saying bipolar is a gift. I'm not saying having a stroke and then having paraplegia is a gift. And I'm not saying things like social injustice is a gift. I'm not saying any of that. But what I'm saying is maybe through the journey, you've learned some things about yourself that you never knew before. And there are things you're able to do now that you may never have been able to do before. It could be that dealing with your own darkness has made it that you're able to sit with another person's darkness easier and then have better empathy in working with them. It could be that you've had to find some sort of purpose and meaning in some of the challenges that you've been through, and that has helped you understand who you are more, so that you can focus your life on things that are meaningful instead of those things that are superfluous. Those are the gifts and the nuggets I'm talking about, not the event or situation itself. Bottom rung, when I was hospitalized, I was cursed. I was feeling hopeless. Everything I did and tried had beaten me down. There was nothing I knew how to do. I got the diagnosis, and it was a double-edged sword. On one token, okay, it's now a thing that can be addressed. It's not just this all-encompassing experience. There's a thing that could be addressed. But it also has a lot of stigma associated with it. Once I got the diagnosis and I started working on the therapy part, it then became difficult. It was better than hopeless, but it sure didn't seem fair. And I didn't like it. And I felt like I had to fight it so it wouldn't beat me. It was difficult. It felt like a part-time job trying to figure it out. I spent some time in that journey, and as I said, I got into occupational therapy, and we started to talk about what are the things that are meaning and purpose for your life. And it became, is what it is. It became, this is the reality that I'm in, and this is the reality that I need to work with. Accepting it does not mean succumbing to it. It does not mean giving into it. But it does mean acknowledging that this is just my reality that I'm working with. The next rung up then, as I was working with it, became teacher. What is it that I'm learning from the experience? Or what do I need to learn to address the experience? And then finally, gift, as I said before. What are those things that I can do now that I never would have been able to do if it wasn't for the journey? I ask 2 things now. Number 1, does this make sense for you and maybe a challenge you've been through? And it's not going up the ladder and then you get to a rung and then you go down and then you've fallen back and failed. It's not that at all. All it is what rung am I on? And am I willing to go one rung up? And all it is a more empowered perspective to take. The other thing I ask, have you, when you're working with people that you're working with, can see them on maybe different rungs of the ladder? And I will tell you this, when I'm in curse mode or difficult mode, there's no way that's a gift. Right? So if you're coming in, someone just had a stroke, and now they're working on doing things again, and they're not participating, instead of labeling them with being treatment resistant, right? Maybe they're just having a really crappy day. So maybe we adjust our approach to work with them. So maybe it's, well, I can totally see, because their whole future, what they thought was going to happen, is now different. There's a journey, there's an emotional, mental journey that goes with all that stuff. So maybe we're just, hey, I know it's feeling uncomfortable right now, and you're right, it is unfair, and it is suck. But maybe what we can do is just grab a washcloth and wash our face and feel a little better. Maybe else. And then maybe we can sit on the edge of the bed, work on trying to sit on the edge of the bed, or sit up, or some kind of positioning, or core stability, core strengthening. Or maybe we go out to the window and look at the birds, transfers. So it's not so much that they're not getting therapy. What we're doing is we're addressing our approach to maybe address what level they're on, so we can meet people where they're at and actually connect with them as people instead of just being patients. An interesting thing about this, going through a challenge, George Barton, one of our founders, was originally an architect. And he became unable to work due to depression, tuberculosis, and an amputation of part of his foot. And what he did is he actually founded the Consolation House in Clifton Springs. And that was a group of people who were dealing with challenges to come together to help themselves and others. Peer support. So what I would offer, something to think about, something to put on your radar, is maybe the origin of our profession is much closer to peer support than it is the clinical medical model. And that could be part of the reason why there's some of the tensions between our approach and what we do and how we work with people versus the way the system tends to operate. I just want to throw that out as something to think about. Dealing with perspectives. Finding purpose. There is quite a connection between perspectives and purpose. And that journey is an internal journey. And it is often one not necessarily recognized. We live in a world where there's a lot of comparison and looking at things externally and then judging with people about that. And I don't know about you, but I find that I tend to judge my challenges against other people's strengths. I do not do apples and apples comparison at all. And so how do we find this? Especially if you're dealing with something where society tends to throw this underground. Because when there's stigma, yes, there's community stigma, but there's something that's even more important and impactful than community stigma, I believe. And that's self-stigma. That's once I start adopting it because I have a challenge I'm less than or having difficulty. So this journey of finding your purpose, finding your perspective, an internal journey. I wrote a children's book. And it's all about that journey, finding yourself from within. And I was thinking I could share that with you today. Is that all right? All right. It is called Move the Morph. As I say with dry mouth. So I should get some water before I say that. Move the Morph. Mubu made many morphing mistakes. sometimes mad, sometimes sad, sometimes glad, sometimes bad. He used the gifts that he had, and always Moo grew. He grew in ways he did not know. He grew in ways that did not show. He grew in ways that made him go, though sometimes it was slow. Sometimes when slow, he could not see where to go or who to be. Ski in the snow, climb up a tree, look down below. Find you, find me, and so Moo morphed. He morphed into a bird to fly way up high into the sky. He'd laugh and sing, and stop and cry. He'd say hello, and he'd say goodbye. He morphed into a shaggy hound, sniffed the ground as he searched around. Sadly still he had not found that heartfelt song, that homebound sound. And so he slipped into the sea, morphed as a fish, swimming free, wondered if he'd ever see what to do or who to be. It's when he looked inside, not out, to his heart's whisper, not another shout. He began to shed that nagging doubt and find out what he was all about. And as he heard that heartfelt song, guiding him to where he would belong, his journey turned out not quite so long. For purpose rings out like a gong. I am a morph. It's what I am. My name is Moo. It isn't Sam. I get to choose what I'll be. A bird, a hound, fish in the sea. Now each of these, they have a place, a way to shine, and a challenge to face. This can make me mad or glad. The choice is mine to be had. So now we turn our thoughts to you. What you've learned, how you grew, what you've done, and what you'll do with that little Moo in you. That's Moo. Perspectives are very powerful things. It doesn't necessarily make all the yucky stuff go away, but how we interact makes a difference of what we do and who we can be. And with that perspective, this is just my contact information, because I do like sharing the stories. I do like presenting at classes. I've been having the opportunity to present a number of occupational therapy programs and stuff. So. But I just again want to comment. Our perspectives make a difference. Our perspectives can influence our purpose, and that can make a difference in not only our lives, but people around us. So gather your perspectives, climb your ladder, and find your purpose. Because when you do, you don't just help yourself, but you help others too.
All right, get me a tissue. Thank you so much, Steve. That was incredibly personal and very impactful. His book is for sale over there. He's staying in the room for a few minutes now, and we'll sign the book if you'd like to purchase it. And in the meantime, he's